Hi, I'm Dr. Josh, and I'm going to take a moment to show you how you can keep exercising, doing lower body exercises, even when your low back is sore. So this video isn't really medical advice. If you're having pain, I'd recommend you get it checked out. Make sure you're clear to exercise. Make sure there's nothing more serious going on. But if you've done all that, and you're wondering how you get back into your workouts, you're tired of just doing nothing but biceps, because you want to do some lower body functional stuff, this might be the video for you. When I think of exercises, I like to classify them into different families of exercises. I kind of stole this from my old biology classes I took, but basically for the lower body exercises, there's three big classes that I tend to work within. You have your squat family of exercises, your hinge family of exercises, and your lunge family of exercises. So within each of those family of exercises or class of exercises, there are dozens, probably hundreds of variations. We're not going to go through all of them today. I'm just going to give you some ones that I often find patients respond well to in the clinic. And then depending on how you're feeling, you can progress them, make them more challenging, or you can regress them and make them a little bit easier. That all depends on your sensitivity, your soreness, your skill level, and your comfort level. So I'll start with the squat. A lot of patients with back pain, the compression of having a bar on their back when their back is sore doesn't really feel very good. So we will actually try and offload some of that compression, some of that weight. And I just try and get people to go through the motions of squatting just to kind of grease the groove and desensitize things. I'll frequently have them anchor themselves to something sturdy. So I'm gonna use my squat rack, but if you don't have access to a squat rack in your house, or it's not easy to get to one, use a doorknob that you're not gonna pull out of the frame because I don't want you to fall on your butt, or even use like your kitchen counter. Both of those work really well. So I'm gonna anchor myself, play around with your stance. Depending on where you place your feet, it will feel different. So it might feel better, it might feel worse, but long term, we want you to be able to do all of them. Anchor yourself to your sturdy object, and then you just sink into that squat, and then pull yourself up using your arms. So sink into that squat, maybe wiggle around, spend some time, get comfortable here, breathe, then pull yourself up. So that offloaded squat will get your back moving, will help desensitize things, bring your hips to a good range of motion. And then you can do 5 to 10 reps of that, and that's usually plenty, but because it's not a lot of weight, you can actually do this pretty often. Now, we'll go on to our hinge class, or hinge family of exercises. And deadlifting for a lot of people with back pain is a bit sketchy, so there's probably nothing actually wrong with it, but it doesn't usually feel very good. Instead, I would say start with a hinge where you're like lying on your back, where it's comfortable, you can control your positioning, and go from there. So I'll just show you the glute thrust. This is my go-to, but you could probably play around with the positioning for this as well. So you lay on your back, play with your foot and like knee angles here, and then just push your hips up into there nice and slow, hold it for a second, breathe, drop back down. If that's way too easy, come up, hold, straighten a leg, bring a leg in, and then come back down. Up, hold, straighten the opposite leg, and come back down. So that's actually going to cover your hinge family of exercises to start. And again, you can make that more challenging, you can make that easier depending on where you're at. The last family of exercises we'll cover in this video is the lunge family of exercises. So that's your good, strong, one-legged movements. I find low back pain patients really like the reverse lunge. It's super handy to use throughout the day as well. So when your back hurts and you're trying to do your shoes, it's generally not very pleasant, but if you can reverse lunge into it, it's a lot nicer. So this is your starting position. You're just lunging backwards and then coming back up. If you need to have a hand on something, totally fine. If you need to put your hands on your knees, again, totally fine. But you're gonna do both legs. It's a great way to train the lunges, maintain that motion, maintain that function, and it'll spare your low back, make it less painful. So these exercises work really well, but when we zoom out, we do want everybody with back pain to slowly be trying to get into their normal activities. So walking, biking, swimming, the other workouts you might do on their side, I want you to slowly get back to work. Like, this is just a little zoomed in area of a big rehab plan that's trying to get people back to their favorite activities and back to normal life. If you have any questions, let me know.